So, welcome to module number 5 of the Real Relief Foundations course. And in this module, we're going to talk about nutritional deficiencies. And it's probably my most favorite topic when it comes to natural medicine for mental health. So before we go on and discuss how nutritional deficiencies could be impacting your mental well-being, I just want to give you a few tips on how to use this module best. So there's 5 sections of this module that I definitely want you to watch. In section number 2, we discuss blood testing and interpretation. And in the first module, I gave you a list of blood tests for you to do. So I hope by now you've got the blood test results back. And in section number 2, I'm going to teach you how to interpret these and give you guidelines on what I believe are the optimal levels. I also want you to watch the magnesium and the omega-3 sections. Because we're not doing any testing for these, I want everybody to watch them and listen to the symptoms that indicate whether you need to supplement with magnesium or omega-3. I also want you to watch the final section in which I talk about supplements and potential side effects or reactions that you may be having to them, as well as follow-up testing. Now the rest of the sections I only want you to watch if you find out that your levels are not optimal. Obviously you can watch them just for interest's sake, if that's what you would like, if you'd like to learn more. But my suggestion is find out through the blood testing where your deficiencies lie and then concentrate on those. So watch those sections and find out what supplements and dietary and lifestyle changes you may need to make to help bring your levels up. So let's move on and discuss how nutritional deficiencies impact our mental health. So these are the 8 nutritional deficiencies or imbalances that can cause depression and anxiety that we're going to discuss in this module. Firstly, we're going to discuss 4 minerals, which include copper, iron, magnesium, and zinc. And the majority of time we'll see mineral deficiencies, but with copper and with iron, an overload or an excessive level can also contribute to poor mental health. We'll also talk about 3 vitamins, including vitamin B12, vitamin D, and folate, which is vitamin B9. Also, we'll talk about omega-3, which is an essential fatty acid. So I just wanted to show a general study that showed that vitamin and mineral levels are lower in patients with depression. This is a study from 2015. And firstly, they showed that intake of vitamin and minerals were lower in people that had depression. And they found that vitamin A, vitamin B1, B2, B6, and folate, as well as potassium, magnesium, calcium, iron, and zinc were all lower. So that was the intake. So they looked at what kind of diet the participants were eating and had a look at it that way. But they also showed through blood testing that most people in the depression group had lower levels of vitamin B12 and folic acid. So I just wanted to show you the research again that this, what I'm teaching you is scientifically validated. So let's have a look at how vitamins and minerals can affect our brain. So let's start off with folate or B9, vitamin B9. It's really important for neurotransmitter production. So we've talked a little bit about serotonin and dopamine as we've gone through this course, and folate is really key there. And studies have shown that patients with treatment-resistant depression, so those that didn't respond to antidepressants, actually have lower folate levels. Moving on, iron is another key mineral for our brain. It's important for energy, and I think this is key when it comes to mental health. Your body needs to have lots of energy, and if you don't have enough energy, you can often feel very low and depressed and melancholic, but sometimes even anxious too. Iron also helps make dopamine. Vitamin B12 is another vitamin, another nutrient that's important for our energy. So we want to rule out a deficiency in this, and it also supports neurotransmitter production. Vitamin D is another vitamin that helps dopamine, and it has anti-inflammatory properties. And as we've learnt throughout this course, we want to lower inflammation in the brain and in the body to resolve depression. Finally, the mineral that I wanted to lastly mention was zinc, and we're going to talk about that later in this module too. And zinc is a really important one. It's involved in serotonin production, and it's also been shown that patients with treatment-resistant depression have lower levels of zinc. So how do we get these nutritional deficiencies? Well, here's 6 reasons you can have nutritional deficiencies. Firstly, a poor diet. So if you're not eating enough vegetables, your folate levels can be very low. If you're not eating enough red meat and eggs, your B12 levels can be very low. But saying that, even if you're eating a good diet, you may have nutritional deficiencies too. So that can be due to our deficient soils and therefore our deficient foods. And it can even be the way that we're handling our foods as well. As I said, a vegan or a low meat diet can lead to nutritional deficiencies. Stress can cause nutritional deficiencies too. Unfortunately, it's a little bit of a vicious cycle. So if you're stressed, you can be losing your magnesium levels, your magnesium, and also other key minerals. But losing those minerals can lead to anxiety and more stress. So by treating our nutritional deficiencies, we can really stop that vicious cycle. Another reason you may have nutritional deficiencies is genetic weaknesses, and the other thing is you may have a genetic weakness that means you need more nutrients than the average person in the population too. Finally, poor gut health is another reason for nutritional deficiencies, and that's why I include all of these key topics in the Foundations course, in the Real Relief Foundations course, because we don't just want to look at nutritional deficiencies, we don't just want to look at what we're eating, we don't just want to look at poor gut health, we want to do all of that. So here's a few questions to ask yourself that will highlight whether nutritional deficiencies are likely to be affecting you. So, do you eat a vegan or a vegetarian diet? I know that I bring this up a number of times in the course, and I know that for some people it's an ethical choice to be vegan or vegetarian, and I understand that. But at the same time, I want to just point out risks. And so because for some people a vegan diet may be a choice because of their health, and so if you know the nutritional deficiencies that you may end up with on these diets, you may change your opinion and include a small amount of red meat or other meat or eggs into your diet, or fish. However, if it is a moral stance, I understand that, but then you can compensate with supplements on a regular basis. So also, do you consume red meat less than twice a week? Because it's not only vegans and vegetarians that aren't getting enough red meat, in my opinion. Do you eat fish less than twice a week? Because we need our omega-3s, and it really is fish that gives us the best omega-3s for the brain. Okay. Do you have dark skin? And do you spend most of your time indoors? Now this highlights a risk of vitamin D deficiency, and you'll want to look at that module and have a look at your blood tests. Are you on the oral contraceptive pill? And if you said yes to this may show that you have high copper, because estrogen in the oral contraceptive pill can increase copper, and copper can lead to anxiety. Do you have white dots in your fingernails? Now this is a symptom or a sign of possible zinc deficiency. Do you eat little nuts and seeds? Now nuts and seeds are great for minerals, and so if you don't include them in the diet, it is possible that you have some mineral deficiencies like magnesium. Are you stress intolerant? So if you are stress intolerant, and stress is one of the things that really affects your mental health, I suggest that you look into the zinc and copper module. Is your iron always low or on the low side? So I meet a lot of people and clients that have said, my iron levels are always low, and they always have been low no matter what I do. So if that's you, I want you to pay attention and watch the iron module too. And finally, do you eat less than 5 servings of fruit or vegetables per week? So if you've answered yes to that, it may mean that you have deficiencies in folate, and folate is really key for mental health. So let's move on and discuss blood testing and the interpretation of your results. So in this section we're going to discuss blood testing, and I'm going to give you some suggestions on the best way to interpret your blood tests. I love this section, and I hope you'll get kind of excited and love to kind of investigate what might be going on for you. So in module number 1, I had given you a list of blood tests to get done, and in the membership site I'd given you a list or a letter to give to your doctor or your lab so that you could get those testing done. So refer to that if you need to. But here's an example of a test result that you may receive, and I just want to make sure that you understand these results. So this is an example of vitamin B12 and folate results, and firstly they will give you the result and the unit. So for B12 here, the result is 236 picomoles per litre. So picomole per litre is the unit. For folate, the result is 5, and the units is nanomoles per litre. Now I'm pointing out the units because it's very important, because in some different countries you will have different units or different measures, and that the results will be expressed in a different unit. So I've endeavoured to include all the different reference ranges with the different units in the course, so it shouldn't be a problem at all, but you need to be very mindful of how your results are expressed. Okay, and here is the normal reference range, the standard reference range. So normally when you get a result, you'll not only get your result in the unit, but they'll also tell you what a normal result is. What's the standard result that most people get? So for the B12, the reference range is 170 to 600. So that would mean that anything below 170 is considered a deficiency, and anything above 600 is excessive levels of that vitamin B12. Okay, and here for the folate, the reference range is 5 to 45. So if you look at your result and say it has 5, and the normal reference range says normal is 5 to 45, you know, the standard medical doctors usually will say, okay, your level's 5, you're fine, your level of folate is fine. But the problem is that result is not an optimal result. So let's consider normal versus optimal blood test results for a moment. As you can see in the figure, in the top area of the figure, this is really what standard reference ranges suggest when we look at our blood test results. So your results can be in the normal zone, they can be low, or they can be high. It's a very black and white view, and the majority of conventional medical doctors, not all, but the majority will use this kind of model when interpreting your blood test results. So if you're in the normal zone, you're fine. Your test results are fine and nothing to worry about. It's when they're outside that zone that we need to think about it and have some concern and do something. But the problem is when you look at it from this kind of model, your results can be normal when, say, it's 100 or it's 20. and most of my clients get it too when they look at these test results. They're like, but what is optimal? What is the optimal area for my blood test result? And so my suggestion is that we don't just look whether your results are inside or outside the normal reference range, but we want to find out what is optimal and whether you have a severe deficiency, if you have excessive levels, or if you're in this sort of grey zone in which your levels, they're not optimal, but they're not severely low, or they're not excessively high, but they are a little on the high side. Where should they be, and what does that mean? Or just for an example, if you look at ferritin, which is the measure of iron stores, the normal reference range is between 20 and 200 micrograms per litre. And so if you were to get blood test results back and your results were 100, your doctor would say they were fine. If they came back as 20, the doctor would say they were fine as well. But if they were 19, then he'd say, oh, you've got a deficiency. Isn't that crazy that if your result is 19, you've got a deficiency, but 20, it's okay? Well, I believe that the optimal zone for ferritin or iron stores is between 50 and 100 micrograms per litre. So if your level's 19 and below, it's a severe deficiency, but it's between 20 and 49, then there's a suboptimal, this is a suboptimal level. And these suboptimal levels are clinically relevant, and so that's what I'm going to teach you in this module, to look for not only severe imbalances but also suboptimal results too. Now let me just make a disclaimer. I am endeavouring to share with you my opinion on what an optimal lab test result is. It is only my opinion, and this area is not without controversy. Okay, different labs have different reference ranges for a start, and these are based on population averages. The standard reference ranges do guide us on what severe deficiencies are, but unfortunately they don't tell us what the optimal result is. So as I said, there is some level of controversy in this area, and your medical doctor may not agree with me. So rather than just looking at this as black and white, I'm just giving you a guideline to consider. But realize that when it comes to severe deficiencies or severe excesses, there is no controversy on this. So those things are quite widely accepted. But realize that I have based my optimal recommendations not just on my own opinion, but what is in the scientific literature, as well as what other experts are saying as well. And I follow Life Extension Foundations, Dr. Kelly Brogan, who's a holistic psychiatrist, and the Vitamin D Council. So let's review your test results. We're going to do it in this order: folate, ferritin, which is iron stores, vitamin B12 and homocysteine, vitamin D, zinc, and then copper. So get your test results out now, and you can start and stop this this video, or you can go through, you can use a workbook to also record your information too. Okay, so here we have the results for serum folate. Okay, and the standard reference range is usually between 5 and 45 nanomoles per litre. And another way that they express this is 2.2 to 19.8 nanograms per mil. So as I said, be careful with what your units are and how your results are being expressed. Okay. So a severe deficiency in serum folate is usually less than 5 nanomoles per litre, or 2.2 nanograms per mil. A deficiency, or a suboptimal level of folate, is between 5 and 25 nanomoles per litre, which is 2.2 to 11 nanograms per mil. An optimal level is usually more than 25 nanomoles per litre, or 11 nanograms per mil. So that's what you're wanting to aim for. Okay, moving on to discuss ferritin, which is an iron store, the measure of iron stores in your body. So when it comes to these results, keep in mind that there are different reference ranges for females and males. And the female reference range is normally 20 to 150 micrograms per litre, and the units can either be micrograms per litre or nanograms per mil. The standard reference range for a male is 30 to 400 micrograms per litre or nanograms per mil. So a severe deficiency in iron stores is less than 20 micrograms per litre for females and 30 micrograms per litre for males. A deficiency is 20 to 50 micrograms per litre for females and 30 to 50 micrograms per litre for males. The optimal level that you'll want to be aiming for is between 50 and 100 micrograms per litre for females, and 50 to 125 micrograms per litre for males. Now, an elevated level, which we will talk about in the iron section, is between 100 and 400 micrograms per litre for females and 125 to 400 micrograms per litre for males. If your results are more than 400 micrograms per litre for females and males, this suggests that you may have hemochromatosis and or high levels of inflammation. So stop iron supplementation and see your doctor. So moving on to serum vitamin B12. Now the standard reference ranges are between 170 to 600 picomoles per litre. And another way to express that, is 230 to 800 picograms per mil. So be careful with your units and make sure you are looking at the right levels. Okay, so a severe deficiency for vitamin B12 is less than 170 picomoles per litre, or 230 picograms per mil. A deficiency is between 170 and 350 picomoles per litre, and that is 230 to 475 picograms per mil. The optimal level that you want to be aiming for is between 350 to 600 picomoles per litre, or 475 to 813 picograms per mil. Finally, if your results are higher than 900 picomoles per litre, or 245 picograms per mil, this indicates that your levels are high and suggests that you may be currently supplementing with B12. If you're not supplementing and your levels are high, go to the B12 section and I'll give you some other possibilities of what it may show. So homocysteine testing. So there's not a specific section on homocysteine in this course, but elevated homocysteine is something that often occurs in cardiovascular disease, stroke, migraines and depression. And if your levels are elevated, it can be a marker of folate and vitamin B12 deficiencies. Okay, so if your levels are high in homocysteine, talk to your doctor about your risk for cardiovascular disease and stroke and migraines, and let him assess that risk. But the best way to bring homocysteine down is folate and vitamin B12. So I've put this test in there as another supportive, sort of more supportive information to help guide you whether you need to be thinking more about your folate and your vitamin B12 levels. So an optimal level for homocysteine is between 7 to 10 micromoles per litre. It's slightly elevated at levels between 11 to 12 micromoles per litre, and it is very high if it's more than 13 micromoles per litre, and you really need to do something about that. So vitamin D is another vitamin that's very key for mental health, and the standard reference ranges are between 50 and 150 nanomoles per litre, or it can be expressed in nanograms per mil. So the standard reference range is 20 to 60 nanograms per mil. So a severe deficiency is in the range of 0 to 50 nanomoles per litre, or 0 to 20 nanograms per mil. A deficiency is 50 to 75 nanomoles per litre, which is 20 to 30 nanograms per mil. And an insufficiency, which means that it's not severe, but there is some mild, it's just not in the optimal range. It is a little bit low than insufficiency. So this range is 75 to 100 nanomoles per litre, or 30 to 40 nanograms per mil. The optimal safe level of vitamin D is between 100 and 200 nanomoles per litre, or 40 to 80 nanograms per mil. Vitamin D over 250 nanomoles per litre, or 100 nanograms per mil, are considered very high, and because vitamin D is a fat soluble vitamin, you want to be very careful about that and take it seriously. I've got some more comments in the vitamin D section if your levels are high. So with zinc testing, the standard reference range is 10 to 17 micromoles per litre, which is 66 to 112 micrograms per decilitre. So a severe deficiency, which means if you do have a severe deficiency, you want to look at the zinc module. The severe deficiency is less than 11 micromoles per litre, or less than 73 grams per decilitre. A deficiency is between 11 and 14 micromoles per litre, and that is 73 to 92 grams per decilitre. The optimal level of zinc that you want to be aiming for is between 15 to 20 micromoles per litre, which is 97.5 to 130 grams per decilitre. And if your zinc levels are more than 20 micromoles per litre, or 130 grams per decilitre, it indicates that your zinc levels are high. The final test that we're going to interpret is copper, and the standard reference range is between 11 and 22 micromoles per litre, which is 70 to 140 micrograms per decilitre. A deficiency is less than 11 micromoles per litre, which is less than 70 micrograms per decilitre. The optimal level that you want to be aiming for is in the vicinity of 11 to 15 micromoles per litre, or 70 to 95 micrograms per decilitre. And if your copper levels are higher than 17 micromoles per litre, or 108 micrograms per decilitre, it's indicating that your copper levels are very high, and you want to watch the module on zinc and copper to find out what you can do about that and what the risks are. So if any of your results sit in the deficiency zone, or the severe deficiency zone, or the high levels, please go on and watch the section in this module that is relevant for you. And next we'll talk about magnesium, and I would like everybody to watch the magnesium section. So let's talk about magnesium, which is a key mineral that many of us are deficient in. So magnesium, as I said, is a key mineral, and it serves as a cofactor in more than 300 enzymatic reactions in the body. So that means it's really vital for how our body and our brain functions. Magnesium is essential for regulating muscle contraction, including contraction of the heart, also blood pressure and insulin metabolism, or blood sugar balance. In the nervous system, magnesium is also important for nerve transmission, so the way that nerve cells communicate to each other. Also neuromuscular coordination. It also protects against excitotoxicity, and this is excessive excitation inside the nerve cells, which can lead to cell death of the nerve cells. So it's very key for protecting against that. So what are the symptoms of a magnesium deficiency? So one of the key ones is muscle twitches and cramps. So if you wake up in the middle of the night with a muscle cramp, then you really need to listen up. Or if when you do exercise you get muscle cramps, you really need to supplement with magnesium, in my opinion. Insomnia can also be related to a magnesium deficiency, as well as anxiety, depression and fatigue. If you have high blood pressure, migraine headaches, osteoporosis or type 2 diabetes, there is a chance that you have a magnesium deficiency. So let's have a look at some of the studies with regards to magnesium and mental health. So low dietary intake of magnesium increases both depression and anxiety risk. So this is a study, an observational study in the general population that was released in 2018. And what it shows is that higher dietary magnesium intake was associated with lower odds of anxiety among women. Women in the highest quintile, which is the top fifth of magnesium intake, had 39% lower odds of anxiety compared to those in the lowest quintile. Deficient magnesium intake was positively associated with anxiety among all women. And it was also shown that lower magnesium intake was correlated with depression in men and overweight women. So there's some small studies showing that magnesium supplementation can be very effective for lowering anxiety and depression. And in these small studies, one showed that 300 milligrams of magnesium can reduce depression in as little as 8 weeks. That's pretty quick, pretty reasonable. And another study showed that between 200 to 300 milligrams of magnesium can reduce anxiety in 3 to 6 weeks. And some studies indicated that the effect of magnesium was similar to lorazepam, which is a calming anti-anxiety medication. So there's a lot of magnesium deficiency causes. Firstly, it could just be low dietary intake, because I'll be showing you which foods are high in magnesium, and to be honest, you actually have to be very intentional about eating magnesium rich foods. Low magnesium in the soils are also a problem around the world. Gastrointestinal disorders such as celiac disease may be a cause of magnesium deficiency, because your intestines and intestinal tract just doesn't absorb magnesium in that case. Too high stress and acidity of the body can lead to the body using up and excreting magnesium too, and so can excessive sweating. High caffeine intake and excessive alcohol intake can also deplete your body of magnesium. And this is, another reason I recommended that you stop drinking or eating caffeine-rich foods and beverages. So if you haven't stopped drinking that coffee yet, here's another reason to do it. And finally, endocrine disorders such as hypothyroidism can lead to a magnesium deficiency too. So here's a few simple recommendations on how you can improve your magnesium levels. So firstly, eat an alkaline diet, which includes lots of vegetables. And if you're following my recommendations from module number 2, you'll be doing this anyway. Epsom salt baths can be a great way to improve your magnesium levels. Epsom salt is actually magnesium sulfate, and so when you have a bath, your body absorbs that magnesium. Also, limit alcohol and reduce your caffeine intake, and easy said than done, but try to reduce your stress. Finally, eat high magnesium foods such as seeds and nuts and legumes, and also replace electrolytes after exercise or sauna, because when you do exercise and when you sit in a sauna, you can lose a lot of magnesium. So it's a good idea to replace magnesium after those activities. So here's some examples of some magnesium rich foods. So if you were to eat 6 Brazil nuts, that would give you 100 milligrams of magnesium. If you were to eat 18 cashew nuts, it would give you 82 milligrams of magnesium. As you can see there, a lot of nuts and seeds are reasonably high in magnesium. So walnuts, hazelnuts, almonds, pumpkin seeds, chia seeds. Buckwheat, chickpeas and baked beans are also great sources of magnesium. And raw spinach has a little bit of magnesium, so 24 milligrams a cup. Avocados 27 milligrams per half an avocado. Salmon has 25 milligrams per 100 grams, and a banana has 32 milligrams, and hummus is 10 milligrams per 1 tablespoon. Note though that the recommended daily allowance for magnesium is for an adult is between 350 and 400 milligrams per day. So let me show you, if you're aiming to eat 350 milligrams of magnesium per day through your diet, this is how you could do it. And I'm really showing you this to show how actually difficult it is to get your magnesium, your recommended daily allowance of magnesium. So you may need to supplement with magnesium. So if you were to eat 2 cups of raw spinach, 1 cup, drink a cup of milk, have a banana, a tablespoon of peanut butter, some multigrain bread, 2 slices of that, a cup of baked beans, 15 almonds, a cup of broccoli, a cup of potato, and 100 grams of chicken, that would total around 350 milligrams of magnesium per day. But most people aren't eating legumes, so you might not eat baked beans. Many people I meet don't eat many seeds or nuts. And if you're choosing to eat white bread rather than multigrain or seeded bread, you're also going to be lacking magnesium. So I hope that shows you how difficult it can actually be for most people to get their magnesium in their diet. So if you're following my guidelines from the Optimizing Your Diet section, on section 2, you would be doing many of these things. Hopefully you're getting some legumes in your diet 3 or 4 times a week. Hopefully you are getting some nuts and seeds on a daily basis too. But really, it's most likely that if you've got anxiety and depression, you probably should be supplementing with magnesium. And here's some guidelines. So consider supplementing between 200 and 300 milligrams of elemental magnesium per day. So the forms of magnesium that I like include magnesium glycinate, which is very calming, magnesium threonate, which is great for the brain, magnesium malate and citrate are very good for energy levels. My suggestion is that you avoid magnesium oxide and magnesium aspartate. Now, magnesium oxide is in a lot of the cheaper magnesium supplements, but it's not well absorbed. The reason I don't like magnesium aspartate is that it can be stimulating to the brain, so I'd just avoid that for mental health reasons. Finally, a lot of people ask me, what about transdermal magnesium creams, getting it through the skin? Well, there aren't really any studies to date showing that magnesium creams work. However, saying that, I have found clients that just don't tolerate magnesium orally. It might upset their tummy. In those cases, the cream has been beneficial and has been really helpful for them too. Also, the creams can be really good for muscle strains and achy muscles as well, so you can do that. As I said, you can also do Epsom salt baths too if you don't want to take magnesium as a supplement, as a lifestyle choice that can improve your magnesium levels. So magnesium supplementation is very well tolerated. If you have low blood pressure, start on a low dose of magnesium and just ensure that you tolerate it. The main sort of side effects that you can have with magnesium is you can have diarrhea or tummy upsets. If this happens, lower the dosage of magnesium and see if you can tolerate lower doses. My suggestion is also avoid magnesium citrate if you find you have a diarrhea effect or you have tummy upsets. And again, consider transdermal magnesium or Epsom salt baths instead. If you're on medication for atrial fibrillation, don't take supplementation without talking to your doctor first. So finally, I just wanted to answer the question, should you supplement with magnesium? Because we're not doing any blood testing for magnesium. They're not overly accurate, so I haven't included them in this course. So my suggestion is that you base your supplementation on your symptoms. So if you have muscle twitches and cramps, then you should supplement with magnesium. If you have poor sleep, you should supplement with magnesium. If you have anxiety or depression, and I suppose you're doing this course for a reason, then you should supplement magnesium. And if you have migraines or headaches, also supplement. So most likely everyone watching today should be supplementing with magnesium, and if you're not, you need to really pay a lot of attention to your diet and increase your dietary intake of magnesium. So let's move on and talk about omega-3, and I want everyone to watch this section of this module also. Omega-3 is another key nutrient for mental health, so let's discuss this topic now. So the brain is the fattest organ in the body. It's made up of 50% fat. So fat is definitely not the enemy. Fat is essential for the body and for the brain. We've talked about this previously in Module 2, but fat is used for fuel and storage. It's used for our brain structure, and it makes up the cell membrane of every cell in our body. It also makes steroid hormones like testosterone and estrogen, and is involved as a chemical messenger. And omega-3, which we're going to discuss now, is actually an anti-inflammatory molecule. So let's talk about omega fatty acids. Omega-3 and omega-6 are the most common fatty acids that we talk about, and they're called essential fatty acids. And they were called essential because they cannot be made or stored in the body. And that means it's essential that you get omegas through your diet. There's two main functions of the omega-3 fatty acids specifically: to serve as a building block, a structural molecule for the outside membrane of all cells, including the nerve cells in the brain, and also they function to produce chemicals which regulate immune system and inflammatory processes. So I just wanted to point out the three major omega-3s because it's important when we discuss what type of omega-3 you should be getting and what form. So the largest omega-3, the most complex omega-3, is DHA, or docosahexaenoic acid, and this is the most abundant fatty acid in the brain. Then we have EPA, or eicosapentaenoic acid, which is a slightly smaller molecule. It reduces inflammation, and it is known to treat depression because of its anti-inflammatory properties. So alpha-linolenic acid, or ALA, is the third type of omega-3 that most people know. ALA is found in flaxseed oil, so it is a vegetarian source of omega-3. The thing is with ALA is that your body has to convert it into EPA and DHA. So it doesn't use the ALA in the brain, but it must convert it, and there's a lot of enzymes and minerals and vitamins that are required in this for this conversion process. So unfortunately only 3 to 6% of the ALA gets converted into the larger, longer chain omega-3s like EPA and DHA. So unfortunately anyone on a vegan or vegetarian diet, or someone not eating fish, may have deficiencies in the EPA and DHA omega-3s, even if they are eating vegetarian sources of omega-3. So what are a few symptoms of an omega-3 deficiency? So firstly, there's a lot of neurological disorders. As you can imagine, because omega-3 is such a large component of the brain, we get behavioral problems with omega-3 deficiency, and anxiety, ADHD, dementia, major depression and postnatal depression are some of the conditions associated with omega-3 deficiency. Because omega-3 has anti-inflammatory properties, we also get immune and inflammatory disorders such as allergies, asthma, autoimmune conditions, eczema, inflammatory bowel disease, psoriasis, and rheumatoid arthritis too. Cardiovascular disease is another condition associated with low omega-3 levels, and taking omega-3 supplementation can really support the heart and the cardiovascular system. So there are physical signs of an omega-3 deficiency, and as you can see there in the image, this is what we call chicken skin, or more technically accurate, hyperkeratosis, in which you have some sort of raised and bumpy skin that's often red. And you often see this in pregnant women or women that have just had their children, because the omega-3s are getting stolen out of their body for the growth of their baby's brain. Dandruff is another physical sign of omega-3 deficiency, and dry skin as well. Oozing earwax is another one too. So if you've got any of those physical signs and you've got depression or anxiety, it's possible that you need some omega-3s. So why do we have omega-3 deficiencies? Well, firstly, pregnancy can be one of the causes of an omega-3 deficiency. The fetus is using omega-3 for the growth of the brain. So the mum gets depleted because the baby needs that omega-3. Also in the general population, not eating enough fish. Okay, so fish is really one of the major sources of those larger long chain fatty acids. There has also been a change in our agricultural practices that really impact omega-3 and omega-6. And for example, that includes feeding cattle or chickens with grain. So when we feed them with grain rather than their natural food source, including grass and for the chickens, insects and things, when we give them the grains, we actually increase the omega-6 quantity in the meat of those animals. Okay, and so we get less omega-3 in the meat sources. An overabundance of omega-6 in our diet has also caused a relative omega-3 deficiency, so an imbalance, too much omega-6 and not enough omega-3s. So in hunter-gatherer diets, it was shown that there was only 2 times more omega-6 in their diet than the omega-3, so a ratio of 2 to 1. Now in our Western diets, it's more like 20 to 1. 20 times more omega-6 than omega-3s. So let's discuss omega-3 and depression for a moment. Research has shown that people with depression, all forms of depression including major, bipolar and postnatal depression, have omega-3 deficiencies. And it's found that women are at greater risk of postnatal depression if they had lower fish consumption or they had multiple pregnancies close together. So if they had children less than 2 years apart. Interestingly enough, maternal DHA, which is the longest omega-3 fatty acid, so their maternal DHA is decreased by 50% after a single pregnancy, and it's not fully replenished by 6 months postpartum, so 6 months after the birth of the child. So it's really important that women consume omega-3 during pregnancy, but they do have to be careful about not overdoing fish because of the heavy metal content. So omega-3 has actually been found in some small studies to be as effective as antidepressant medications are. So specifically, however, the EPA form of omega-3. So in this study here, EPA, the form of omega-3, was found to be as effective for treating major depression as fluoxetine. And fluoxetine is an SSRI medication, so a selective serotonin reuptake inhibitor. It was shown that half of patients had a 50% reduction in depressive symptoms with either treatment. But if they combine the treatment using fluoxetine and omega-3, 81% of patients improved. So it's pretty amazing stats. So the conclusion is that omega-3 is comparable to antidepressant medications, and it actually makes antidepressants more effective when they combine it together. Now, the studies around omega-3 and anxiety are limited. It's really in its infancy at the moment. There was one study that showed that anxiety symptoms are associated with reduced omega-3 levels, and another study showed that depression with anxiety is associated with reduced omega-3, whereas pure anxiety was not. So I just wanted to share this testimonial. I was suffering from anxiety and low mood during my pregnancy. I was off work for months and life felt hopeless. I thought that antidepressant medications were the only option for me. I saw Dr. Janelle, and the supplements she prescribed have changed my life, and this included omega-3 supplementation. I was back to work within 3 weeks, was able to work throughout my pregnancy, and had no problem with postnatal depression. I now feel healthy as ever, and I don't have depression or anxiety. It's just amazing, isn't it? When we give the body the nutrients that's needed, it can bounce back. And it's so important too during pregnancy when the fetus, the baby, is needing so many nutrients to grow. So here's a few suggestions about improving your omega-3 levels. So firstly, limit the use of vegetable oils high in omega-6, such as soybean oil, sunflower oil, corn oil, and sesame oil. Eat cold water fatty fish 2 to 3 times a week, including salmon, sardines, wild trout, herring, anchovies, and mackerel. Remember to avoid large fish as they have higher levels of heavy metals, and examples of this include tuna and swordfish. Eat eggs that are labelled high in omega-3. So these chickens probably have been probably more free range and not being fed corn supplements. So consider also omega-3 supplementation. So let's discuss the dosage recommendations for an adult for omega-3. Now this recommendation is specifically for mental health, just like all the recommendations in this course. They're not general dosage recommendations, they are specific for mental health. So what you need to be taking is between 1,000 to 2,000 milligrams of EPA daily. So that's the most important dosage, that you want to make sure you're getting that level high. However, you'll also have some DHA in your omega-3 supplement as too. So anywhere in the vicinity of 400 to 800 milligrams of DHA daily is good. The lower the DHA, the better, specifically for the treatment of depression. The ratio of EPA to DHA should be in the range of 5 to 2 or 2 to 1. So in one capsule you should have 500 milligrams of EPA to 200 milligrams of DHA. So omega-3 is safe alongside antidepressant medication, and as we saw, there's some studies to show that it can actually make antidepressants more effective. So just a word of caution, omega-3 has blood thinning properties. So if you're already on a blood thinner, you may need to monitor your requirements and, under the guidance of your doctor, possibly lower the blood thinner medication if you're taking the omega-3. So can you treat depression with omega-3 food sources? I think this is a really great question, because a lot of people are like, no, I just want to eat food. I want to do it naturally. I don't want to take supplements. Well, the research shows that you can't treat depression with omega-3 food sources, not safely anyway. So to consume 2,000 milligrams of combined EPA and DHA, you'd have to eat 150 grams of salmon per day every day. And if you wanted to do that with tuna, which I do not recommend, hear me, I do not recommend this, you'd have to eat 850 grams, that's 30 ounces of tuna per day every day to treat poor mental health. The problem is with this amount of fish, consuming this every day, it would lead to very high heavy metal levels. So I do not recommend eating fish every day. The problem also with this is that these foods don't give you the balance of DHA to EPA that you actually need to use to treat depression. But I sort of just wanted to show you that you really do need to supplement omega-3s. Diet alone isn't right for treatment. So I just thought I'd give you some guidelines on how should you supplement with omega-3. Okay, so I think you should if you're on a vegan or vegetarian diet, if you haven't eaten fish every week for years, if you've got chicken skin, the hyperkeratosis on the back of your arms, if you've got cardiovascular disease, and if you have depression and haven't tried omega-3 before. should you supplement with omega-3? My answer is no if you've reacted badly to it in the past. If you've tried omega-3 in the past at high doses that I've recommended for long enough and did not experience any benefits within 3 months or something, then maybe not try omega-3s again. And if you've eaten fish twice a week for the last 5 years, fatty, oily fish, okay, in good portions. I'm just giving you these guidelines, and it's not perfect, and there's not really, this isn't really a science, but I just wanted to give you some guidelines on should you be taking omega-3s or not, because there are tests for it. There's integrative medical tests for omega-3 levels that are available, but they're not available just through your standard medical doctor. So I just wanted to give you guidelines. And finally, what about krill oil, algae omega-3, or flaxseed oil for mental health? Because I have lots of people saying, I don't want to take fish oil, I want to take one of these 3. And here's my answer. So krill oil is sustainable, so it is a good source of omega-3 from that perspective. Has lower levels of heavy metals and toxins, and may be more bioavailable, which means you may not have to take as large a dose. The good news is that with krill oil there's more EPA than there is DHA, which means that we've got the right balance of the omega-3 components to treat depression. With algae oil, again, it's sustainable and it's a vegetarian source, and it has lowered levels of heavy metals and toxins. The difficulty that I have with algae omega-3 is that it has higher DHA compared to EPA. And as I've discussed, it's the EPA, not the DHA, that treats depression. And it's most likely the having higher levels of EPA compared to DHA that makes it effective. Lastly, some people are like, I take flaxseed and I take that every day, but for mental health I just don't think, it's just not adequate. It is sustainable, it is vegetarian, but it doesn't contain EPA or DHA, and only 3 to 6% of the ALA, which is the omega-3 in flaxseed oil, only 3 to 6% convert to the longer chain omega-3s, EPA and DHA. So there are no studies that show that krill oil, algae omega-3 or flaxseed oil can reduce depression. I've scoured the scientific research and the studies just aren't there. So I cannot recommend any of these oils for the treatment of depression. It is only fish oil with more EPA than DHA that is effective. You could use these things for maintenance in the future, but not for treatment, in my opinion. So hopefully you can see yourself and recognize symptoms of an omega-3 deficiency, and that can help you decide whether in the future you need to be supplementing omega-3, because it really is effective for improving mental health. So now we're going to move on and talk about folate. So if you have a folate deficiency based on your blood test results, I want you to watch the next section. So now we're going to talk about the super important topic of folate. And you may know folate as folic acid, but folic acid and folate are both terms used for vitamin B9. And folate is an essential vitamin, and this means that you must provide it through your diet or through supplementation. Folate occurs naturally in foods, whereas folic acid is a synthetic folate. It is found in supplements and added to fortified foods. Now, the term folic acid and folate are often used interchangeably, but they really are two different things. And it's folate supplements and folate from foods that you really want to have in your body, not the synthetic folic acid. So folate has a lot of important functions in the human body. Firstly, it's involved in red blood cell formation, and as you'd know, with red blood cells, they're important for providing oxygen around the body. So if you're low in folate, that on its own can give you low energy levels. Folate's also important for DNA production, and DNA is our genetic material. So this means it's important for cell growth and function, and also cancer prevention. You may know folate or folic acid when it comes to neural tube defects and spina bifida, and using folic acid during pregnancy to prevent that. Well, that's because folate reduces the risk of these birth defects of the brain and the spine. Folate also contributes to normal brain function, and it helps create neurotransmitter production. And our neurotransmitters are really important for mental health, as you know, dopamine and serotonin. And folate is also involved in a biochemical process called methylation. And methylation helps us make neurotransmitters in a different manner, as well as helping detoxify the body. So folate is very essential for the body, and here's a list of some of the folate deficiency symptoms. Firstly, you can have some physical signs such as a sore mouth or a swollen tongue, grey hair, pale skin or shortness of breath. The fetal neural tube and brain defects are an obvious one, but anemia, high homocysteine levels and heart palpitations can be signs of low folate levels too. Now, there's many neurological symptoms for a folate deficiency, including fatigue, weakness, lethargy, depression, irritability, confusion and cognitive decline. So that's one of the reasons with any clients that I see with low mood and fatigue, I'm always looking at their folate levels. Now, there is a lot of evidence showing that folate is important for mental health, and here's just a snapshot of a few of these observations. So 30% of newly admitted psychiatric patients have low folate levels, so we observe it a lot in poor mental health. But patients diagnosed with major depression have lower concentrations of folate compared to other people. And here's the clincher, I think. The lower the folate level someone has, the more severe and more prolonged their depression. And the lower the folate, the more treatment resistant they usually are. And so that means that more likely to not respond to antidepressant medication. Now, there's a special form of folate called methylfolate, and it's used as an antidepressant medication in the United States. And that's how powerful it is. It's actually used as a medication for low mood. But it's available as a supplement too, so it's readily available, and I'll be talking about that in the supplementation section. So what leads to low folate levels? What are the risk factors and causes for a folate deficiency? Well, here's a short list. So firstly, low dietary intake. So you're just not getting enough folate through your diet. Well, that can happen if you're not eating enough fresh fruit and vegetables and legumes too. Also, eating only cooked vegetables or overcooking them can be a cause of for low folate levels. Also, malabsorption because of gastrointestinal tract conditions such as celiac disease and Crohn's disease. You're just simply not absorbing the folate from your food. Also, pregnancy, alcoholism, and particular medications can lead to low folate levels. And there's a particular genetic weakness called the MTHFR gene, and these genetic weaknesses mean that you don't process folate very well in the body, and it can cause a deficiency, or it could just mean that you particularly need a lot more folate in your body to function well. So here's a list of a lot of different medications that may lower folate levels. So the oral contraceptive pill is the most common medication that you'd be familiar with, but also anticonvulsants, cholesterol lowering medication, anti-inflammatory treatment, cancer, malaria treatments, also a couple of particular antibiotics and a diuretic. So if you're on any of those types of medications, look specifically for the name of the medications that's listed on this slide. So we've discussed the interpretation of your folate blood test results already, but let's just go over them again. So you have a severe deficiency of folate if your levels are less than 5 nanomoles per litre or 2.2 nanograms per mil. You have a more mild deficiency if your levels are between 5 and 25 nanomoles per litre or 2.2 and 11 nanograms per mil. And the optimal level of folate is above 25 nanomoles per litre or above 11 nanograms per mil. Now we also are looking at homocysteine levels, and homocysteine levels, if they're elevated, may show that you need more B vitamins such as folate and vitamin B12. And the optimal level of homocysteine is between 7 and 10 micromoles per litre, and anything above that is elevated and indicates that you may need folate or B12. So if you do find that you've got low folate levels, I think it's something to be excited about, pleased about, because it means that there's something that you can do about your low mood and low energy levels, and possibly anxiety too. So here's a few ideas on how to improve your folate levels. Firstly, eat folate-rich foods. Now, as part of the course, I've given you a lot of bonus documents, and there's one bonus called the Real Relief Real Food Planner. And in that document, you will find a page on folate, and you'll find a page on a lot of the other nutrients in there too. And it will provide you with the list of 10 top folate-rich foods. So please use that resource. Another reason, another way that you can improve your folate levels is to eat more raw vegetables, because that way the folate vitamin is left intact. Or you may just lightly steam your vegetables rather than really boil the heck out of them. Limiting alcohol and supporting gut health will improve your folate levels too. And as I said, review your medications. Obviously, you need to stay on essential medications, but if it's if there's any way to go off those medications or reduce them, then you can consider that too. Also review your NTHFR genes, okay, and see whether you have a genetic weakness in that area that could mean that you need more folate. And finally, supplement with methylfolate or folinic acid, and I'll talk about that in a moment. But firstly, here's a list of folate-rich foods. So citrus fruits, broccoli, lettuce, spinach, beetroot, avocado, seeds and nuts, asparagus, beans, peas and lentils. So really, if you're eating like I've recommended you do in module number 2, where we use the plate planner, and half of your plate at every meal ideally has vegetables or fruit on it, then you should be getting your folate levels right for the day, because the RDA for an adult is 400 micrograms per day. When it comes to folate supplementation, the standard dosage is between 400 and 1200 micrograms of methylfolate or folinic acid per day. And I'd recommend that you take it with breakfast, because it is a vitamin, so it's usually will lift your mood and your energy first thing in the morning, whereas if you take it at night, it may affect your sleep. So 800 micrograms is the most common dose, and I would usually recommend methylfolate, but if you have an issue with anxiety or methylfolate increases your anxiety, you may want to consider folinic acid instead. And I always recommend that you start on a low dose and increase slowly to avoid side effects. So avoid folic acid, okay? Make sure that when you're looking at your supplements that you look to make sure it's methylfolate or MTHF. So folate supplementation is very well tolerated and it's safe alongside antidepressant and anti-anxiety medication. It may improve your response to antidepressant medications too, which is a great thing about combining natural medicine with antidepressants. We can often make the medication more effective. Now, the main potential side effect of folate supplementation is increased anger, anxiety or poor sleep onset. If this happens, I would just reduce the dose and see if you can find a level that suits you, or you can switch to using folinic acid instead of the methylfolate. So now we're going to move on and talk about iron, which is a very overlooked but important mineral for mental health. Now this section is all about iron, and iron is an essential mineral. And you're probably very familiar with iron's function, a main function in the body, and that is to help form and oxygenate blood cells and hemoglobin. And so when you don't have enough iron, you're going to feel very fatigued. But another function of iron is to convert food to energy, also help maintain a normal immune system, and finally it contributes to normal brain function. And when it comes to minerals in the brain, it's actually iron is the mineral that has its highest concentration in the brain, and so it's very important. And it shouldn't surprise you, but about 20% of women, 50% of pregnant women, and 3% of men don't have enough iron in their bodies. So it's an essential for anyone with poor mental health and poor energy levels to check out their iron. So here's some iron deficiency signs. So these are the ones that most people will know about. Extreme fatigue, weakness, pale skin, fast heartbeat or shortness of breath, headache, dizziness or lightheadedness, cold hands and feet, inflammation or soreness of your tongue, brittle nails, unusual cravings such as dirt, and a poor appetite too. But did you know that iron deficiency symptoms can really show as poor mental health? So you can have poor memory, learning can be impaired, and concentration and intelligence too. You can have suicidal thoughts just from having too low a level of iron. Anxiety, depression, and panic attacks too. So you want to get your iron levels tested through the blood tests that are recommended for sure. So here's just one study on iron and postnatal depression. And this is a randomized double-blind placebo-controlled trial. And this was a trial with mothers who had just given birth. And they were given 50 milligrams of iron per day or placebo for 5 weeks. And iron deficiency decreased in the iron treated group, which is no surprise, but postnatal depression scores significantly decreased in the iron treated group as well. And the improvement rate for postnatal depression was significantly higher in the iron treated group, so that 42.8% versus 20%. And mothers with continued postnatal depression had lower ferritin, which are iron stores, than the improved mothers. So this is a study showing that iron supplementation is really important for postnatal depression prevention and treatment. So here's 9 causes or risk factors for iron deficiency. I mean, the most obvious is a lack of iron in your diet. You're not eating iron-rich foods. Also, a vegetarian diet is another reason, because you're not eating red meat. An inability to absorb iron. So that may mean be due to poor gut health or celiac disease. Pregnancy is another common cause. High consumption of dairy, tea or coffee can be a reason that you've got iron deficiency, because these block your body from taking up the iron in your food. Heavy periods or blood loss from the bowel mean that you're losing more iron than you are consuming. So let's have another look at ferritin, which are iron stores blood tests. Okay, and let's just have a look at the testing and interpretation of those test results. So keep in mind that there's different levels, different levels for females and males. And so you have a severe deficiency. For females, you have less than, if you have 20 micrograms per litre or less, or for a male, it's less than 30 micrograms per litre. You have a mild deficiency if you have levels between 20 and 50 micrograms per litre for a female and 30 to 50 micrograms per litre for a male. The optimal level for ferritin for females is between 50 and 100 micrograms per litre and 50 and 125 micrograms per litre for males. You have an elevated level if your levels are above are between 100 and 400 micrograms per litre for a female, and between 125 and 400 micrograms per litre for a male. And in this case, stop your any iron supplementation and maybe consider giving blood if it's on the higher side of that range. Now, if your levels are above 400 micrograms per litre for males or females, this could suggest that you have hemochromatosis, or you have some inflammation going on in your body, and you may need to retest your levels in a month's time. But if your levels are that high, I highly recommend that you talk to your medical doctor and definitely stop any iron supplementation if you're already on it. So there's 3 ways to treat an iron deficiency. So if your levels are your blood test results have come back and they show that you have low iron, if you have a deficiency, there's 3 things that you can do. Firstly, you can improve your iron intake by the foods that you eat. Number 2, you want to ensure good gut health, because as you improve your gut health, you improve absorption of any iron that you are eating. And thirdly, iron supplementation. So let's talk about each of these 3 things for a moment. So here's a list of iron-rich foods, and these are the heme sources, and heme sources are really just animal-based sources of iron, and heme sources of iron are more easily absorbed. It's just a list here of all the iron-rich foods: beef, liver, poultry, lamb, fish and shellfish. And note that the recommended daily allowance, the RDA for adults, is 8 to 18 milligrams per day. So the lower level is for men, and the higher level is for women who are menstruating. Keep in mind that the vegetarian RDA for iron is actually higher. It's actually 1.8 times higher, and so the RDA is 14 to 32 milligrams. And the reason for this is that iron-rich foods that are plant-based give us non-heme iron, and non-heme iron sources are not as well absorbed as animal-based iron sources. But here's a list of the iron-rich plant-based foods. So dark leafy greens, chickpeas, lentils and beans, cooked oats, pumpkin seeds, tofu and quinoa. So also remember that bonus that I spoke about, the Real Relief Real Food Planner, and it has a list of the iron-rich foods in there as well. So it's good that you're increasing the foods that are rich in iron, but to improve your iron absorption, you can do these two things as well. You can avoid eating iron-rich foods alongside coffee, tea, or dairy products. And secondly, you can eat the iron-rich foods alongside vitamin C-rich foods, and they would include a lot of your fruit and your vegetables. So let's just talk about gut health and iron for a moment. So firstly, avoid antacids or acid reducing medication. Now these medications are going to interfere with your body's ability to absorb iron. Secondly, rule out celiac disease, and we've talked about that in the addressing food sensitivities section, and we've talked a little bit about that too in the gut health section too. Also consider going gluten-free or trial the low FODMAP diet. So if you've had very low levels of iron all your life and you've really struggled to get them up, even through supplementation or improving dietary intake of iron, consider going gluten-free or, as I said, trialing the low FODMAP diet, because this can improve your digestion and mean that you are going to increase the amount of iron that your body can absorb from its food. Also check your stomach acid levels. Remember the stomach acid test? Make sure you do that and treat that accordingly. If indicated, repair the intestinal lining of your intestines as well, and see the gut health module for more information. So here's a few pointers on iron supplementation. So my recommendation if you have low iron is to take 50 milligrams of elemental iron once or twice a day. Avoid ferrogradimate or ferrous sulfate as it is constipating. Ferrous bisglycinate or carbonyl iron are well tolerated, and these are the forms of iron that I would be recommending. If you get constipation with any of these forms, it may indicate poor gut health, so think a little bit more about that and pay a particular attention to the supporting your gut health module. Remember that iron must be taken on an empty stomach away from other food and medications, and this is usually 1 hour before food or 2 hours after a meal. And you can also take vitamin C with the iron to improve the iron absorption. So iron is a well-tolerated medication, and there's no concern with taking it alongside antidepressant or anti-anxiety medication. But I do have one word of caution, and that is that many iron supplements contain folic acid. And in the last module I spoke about how folic acid is synthetic and it's not what you really want to be feeding your body, because folic acid can make some people's anxiety worse. So my recommendation is only take iron supplements that do not contain folic acid and only contain iron on its own, and supplement with folate separately if you require it. Now the supplement bonus that I've given you in the bonus section, the iron that I have recommended there is just iron on its own, so it doesn't have any folic acid. So for anyone that has found that they've got high levels of ferritin, I just wanted to talk a little bit about hemochromatosis or iron overload. So this affects one person in every 200, and it is more common in men but can be found in older menopausal women, so women that don't have their period anymore, and so the iron has been able to build up. So remember that too much iron is toxic to the brain. It creates high oxidative stress, so you really don't want your iron levels to be too high. Now, to have a diagnosis of hemochromatosis, you're usually looking for ferritin above 400 micrograms per litre and transferrin saturation levels above 55%. But I recommend that you talk to your doctor more about that. Symptoms of hemochromatosis do include tiredness, fatigue, abdominal discomfort, joint pain, generally feeling unwell, impaired memory and mood swings, as well as severe irritability and depression. So take this seriously and make sure that you get treated by your medical doctor. The standard treatments is just to give blood regularly, donate blood, so that you're really removing that iron out of your body. Review your intake of iron-rich foods such as red meat and only consume moderate levels of that. Avoid taking vitamin C with foods that are rich in iron, and avoid using iron cookware. So I just wanted to share this testimonial from one of my clients, just because I wanted to show you how significant low iron levels can be. So this is a 34-year-old woman with 3 children, and she had high anxiety on a daily basis and felt like she had burnout. The anxiety was worse 2 weeks before her period, and she had a panic attack and weird heart palpitations. She passed out at work, and she told me that she felt crazy. We found that she had low ferritin levels, so very low iron levels, and she was very deficient in vitamin D. And she'd only recently been diagnosed with celiac disease. And her gastroenterologist, the doctor that looked after her when it came to her celiac disease, said that her vitamin D levels were really third world levels, and he didn't usually see levels like that. He also said that no one ever tests for vitamin D, and it was only under my recommendation did she get that testing done. And so the thing is that she turned up at the hospital, and she was prescribed anti-anxiety medication. But luckily the next week she went to see her medical doctor, and this was sort of between our first and second appointment, and I hadn't seen the results yet. But her medical doctor had access to these results, and she saw that this woman had low iron and vitamin D levels, and so she prescribed, she gave her an injection for iron to improve her levels because of the celiac disease. She wasn't absorbing iron very well, and then she was put on very high dose vitamin D, and her panic attacks and anxiety resolved within a week or so, I think, or even days. And she came back to me and said, I just want to thank you, because if you hadn't done those tests for me, I would have been on antidepressant medication long term, or anti-anxiety medication long term, I'm sure, because that would have felt like the only option available to her. And she says that whenever she has her anxiety start to creep in and come back, she always goes and gets her iron and vitamin D levels tested, and then supplements if she needs them, because she usually finds that those levels have dropped too low, and that's why the anxiety has come back. So don't underestimate the just one mineral, just even iron or a vitamin like vitamin D, because it really does have a huge impact on your mental health. So join me next to discuss vitamin B12. Vitamin B12 is another essential vitamin for mental health. And so let's discuss that now. Vitamin B12 is known as cobalamin, and it plays a major role in making DNA, the genetic material in all our cells. It also helps with red blood cell formation and production. It's quite similar to folate in many ways. It helps keep the body's nerve cells healthy too by making myelin for the nervous system. It's key in for dopamine and serotonin production, those key neurotransmitters that help calm us down and help us be happy too. And vitamin B12 is key also in the methylation cycle, which is important for neurotransmitter production and detoxification. So let's take a look at some of the symptoms of a B12 deficiency. So weakness, fatigue, numbness or tingling in the hands, legs or feet are some of the neurological symptoms. If you've got numb hands or tingling in your hands, that's one of the key signs. And I've put some little stars next to the 3 signs that I think are really a hallmark of vitamin B12 deficiency. You may have difficulty walking or balance problems too with a vitamin B12 deficiency, impaired memory, irritability, dementia, depression, anxiety, and even psychosis. Now, some physical signs of a B12 deficiency include anemia, paleness, a swollen or inflamed tongue, or burning or itching in the mouth, and shortness of breath. So here's just a few observations when it comes to vitamin B12 deficiency in depression, OCD and mental health. So they've observed that 20% of hospitalized psychiatric patients are low in vitamin B12. Vitamin B12 concentrations have been shown to be lower in depressed patients than non-depressed patients. And lower vitamin B12 levels have also been observed in obsessive compulsive disorder. I've even seen case studies showing that psychosis can be caused by low vitamin B12 levels. So let's take a look at some of the causes or risk factors for B12 deficiency. Firstly, we need to look at the diet to make sure that you're getting enough B12 in the diet. And a vegetarian diet will most definitely be low in B12. You must get B12 through animal products. With a vegan diet especially, there is no sources of vitamin B12 in a vegan diet. In vegetarian diets, if you're eating eggs and I think possibly cheese, you can get a small amount of B12 through those foods. Pernicious anemia is an autoimmune condition in which B12 levels are affected. But aging and alcoholism will both decrease or be a risk factor for B12 deficiency. And Crohn's disease, celiac or gastric surgery can lead to B12 deficiency too. And also low stomach acid or stomach reducing meds. Finally, there are genetic weaknesses that can mean that you don't absorb B12 very well, and that can lead to low levels of vitamin B12 too. So here's just one study comparing, showing a vegetarian diet and mental health, and it looked at vitamin B12 levels. And so vitamin B12 levels were significantly lower in the vegetarian group compared to an omnivore group, so people that eat meat and animal products. And the levels of B12 that were found in the vegetarian group on average were 238 picograms per mil, whereas in the omnivore group they were higher, they were 400 picograms per mil. And in vegetarians compared to omnivores, depression rates were higher, so 31% of vegetarians had depression, whereas only 12% of omnivores did. There's also an increased percentage of vegetarians with tingling or numbness in hands and feet. And as I said, that is a hallmark of vitamin B12 deficiency. Also psychosis was found in 11% of people that had a vegetarian diet, whereas only 3% in those who have an omnivore diet. And the conclusion of the study was that vegetarians have vitamin B12 deficiency and are more prone to developing neuropsychiatric and neurological problems. Now, I understand if you eat a vegetarian or vegan diet for ethical or moral issues, but I do need to point out the risks with these diets. If you are on a vegetarian or vegan diet, I would be recommending that you supplement with vitamin B12 every day if you stay on that diet. So let's take a look at blood testing for vitamin B12, and we're looking at serum vitamin B12 levels. And so you have a severe deficiency if your levels are less than 170 picomoles per litre, and that is 230 picograms per mil. You have a mild deficiency if it's between 170 and 350 picomole per litre, which is 230 to 475 picograms per mil. And an optimal level for vitamin B12 is between 350 and 600 picomole per litre, which is 475 to 813 picograms per mil. Now, if your levels are higher than 900 picomole per litre or 1,245 picograms per mil, this may indicate that you're currently supplementing vitamin B12, and is usually of no concern. Now, I just also put the homocysteine testing in here, because if your homocysteine levels are high, it indicates that you probably need some more B vitamins like folate and vitamin B12. So if your level is 11 or more for homocysteine, then that's another sign that you should be supplementing with vitamin B12 or looking at your diet. So there's 3 ways to treat a vitamin B12 deficiency: through your food, also ensuring good gut health, and also vitamin B12 injections or supplements. So here's a list of some key vitamin B12 rich foods. So beef, liver, poultry, eggs, shellfish, fish, milk and cheese. And you can see that all of these are animal-based products. You can get some B12 in fortified processed foods as well. But if you are a vegan or vegetarian and you're eating mostly whole foods, then you're most likely not getting that B12 through packaged foods, so you will want to supplement. There's 2 main ways to supplement vitamin B12. Firstly, injections or supplements that you take orally. Now with the injections, these are available through your doctor, at least here in New Zealand, through a prescription, and they're really just used to treat a severe deficiency in vitamin B12. Most doctors are unlikely to treat you for a mild deficiency with B12 injections. The good thing about injections is they provide a quick benefit. Often you'll experience improved mood and energy levels the day after an injection because you've been injected with a high dose of B12. The problem is that injections aren't very good for maintenance because you'll have an injection, your levels will go up quite high, but then as time goes by your B12 levels will drop, and if your gut health is poor, or if you're not eating enough B12 rich foods, your levels can go down and your mood and your energy levels can deteriorate, and then you have to wait till your doctor says your blood test levels are low enough for you to get the next injection. So your mood and your energy can go up and down quite significantly with the injections. Saying that, if you do have a severe deficiency, I would recommend getting an injection if you can, but then using supplements to maintain your levels long term. So when it comes to supplements, they're available without a prescription, so that's great, and they'll provide more gradual benefits for those with severe deficiencies. They are excellent for maintenance, however, and just keeping your levels constant. Sublingual lozenges, drops or sprays should be used because your body can absorb vitamin B12 much better sublingually, so through the cheek or underneath the tongue, because capsules of B12 aren't absorbed very well by the body. So the dosages that I recommend for a deficiency start at 500 to 1,000 micrograms per day, and you would definitely take these with breakfast, because B12 can impact your sleep if you take them too late in the day. Now, the main form of B12 that is recommended is methyl B12 or methylcobalamin, and that's the recommended form. However, I've got a few suggestions and precautions about B12 supplements. So they're usually very well tolerated, and they're safely taken alongside antidepressant medication. The main side effects that you may have if your dosage is too high is insomnia or difficulty getting to sleep. So if that happens, have vitamin B12 earlier in the day or reduce your dose. If the vitamin B12 increases your anxiety, or you have some sensitivity to methyl B12, my suggestion is to change to hydroxy B12 instead. And in the supplement bonus, I have given you some recommendations about where you can find the hydroxy B12, because then it's not a common supplement that is necessarily easy to find. So that wraps up vitamin B12, and we're going to move on and talk about vitamin D now. So what's back pain, hair loss and muscle pain got to do with depression? Well, they can all be caused by a vitamin D deficiency. And vitamin D is such an important vitamin, another important vitamin for mental health, and it's so overlooked and misunderstood by so many health professionals. And so vitamin D is really key to measure and to look at when we're thinking about depression and anxiety. So many of you will know that vitamin D is often referred to as the sun vitamin. It's a steroid vitamin made by your body when your skin is exposed to the sun. And most people think, and most health professionals and most medical doctors too, that vitamin D is just all about calcium absorption and bone health, but it's actually got so many more important functions in the body too. It helps with the immune system, with cardiovascular function, for brain development and mood, and it even has anti-cancer effects. Worldwide, approximately 35 to 55% of adults are vitamin D deficient, so it is a very, very big problem. In the US, 41% of whites, 82% of African Americans, and 69.2% of Hispanics have low vitamin D levels. And here in New Zealand, where I'm from, 48% of adults and 57% of newborns have low vitamin D levels. So there's a number of symptoms that you may experience with low vitamin D. Some of the physical symptoms include bone loss and rickets, which are really the classical symptoms of low vitamin D. Bone, muscle and back pain, hair loss, poor wound healing, irritable bowel syndrome, diabetes and obesity. It's also correlated with poor immunity, so frequent infections, autoimmune conditions and cancer too. From a neurological perspective, fatigue and tiredness is a hallmark of vitamin D deficiency. Anxiety, depression and SAD, which is seasonal affective disorder, so depression during the winter. Also psychosis, bipolar disorder, dementia and obsessive compulsive disorder may be correlated with vitamin D deficiency. The thing is, vitamin D is important for mental health. It's known to help increase dopamine, it lowers inflammation of the brain, it increases brain growth factors, and it lowers oxidative stress. It's essential that we have optimal levels of vitamin D. So here's just one study on fatigue and vitamin D, and I thought this was quite interesting. So there's a study in which patients presented with fatigue to a medical clinic, and it was found that 77% of these people had low vitamin D levels. So the patients in the study were given vitamin D supplementation for 5 weeks. So they were given 50,000 IU 3 times a week for 5 weeks. And after normalization of their vitamin D levels, the fatigue symptom scores improved significantly. I think what was interesting is that half of those patients were already taking vitamin D. So they were already taking 1,000 to 2,000 IU daily before the start of the study. So this illustrates how important it is to actually have your vitamin D levels tested so you can determine what dosage of vitamin D you actually need to get your levels right up to the optimal level. So vitamin D is also very important for pregnant women, and here's a study showing vitamin D deficiencies in perinatal depression. So perinatal depression is depression through pregnancy rather than after childbirth. So the study showed that low levels of vitamin D early in pregnancy were associated with higher depressive scores in both early and late pregnancy. So I believe that we should be testing all pregnant women for their vitamin D levels and getting them up to an optimal level so we can prevent depression during pregnancy and postnatally as well. So here's 7 risk factors for a vitamin D deficiency. Because vitamin D is the sun vitamin, and pretty much the only way to get vitamin D is through being out in the sun, other than supplementation. So if you stay indoors and you don't get exposed to the sun much, this is obviously a risk factor for low vitamin D levels. Being overweight is another risk factor. Having dark skin means that you don't make vitamin D as effectively as someone that has very light skin. So if you have dark skin, you need to be staying out in the sun for much longer extended periods of time to make adequate vitamin D levels. Another risk factor is not eating fish or dairy, and also wearing sunscreen while in the sun. Living far from the equator is another risk factor, as well as being older in age. So let's have a look at vitamin D testing, and we've gone over these before, but basically you have a severe deficiency if your levels are less than 50 nanomoles per litre or less than 20 nanograms per mil. You have a mild deficiency if it's between 50 to 75 nanomoles per litre or between 20 and 30 nanograms per mil. You have an insufficiency, so between 75 and 100 nanomoles per litre and 30 to 40 nanograms per mil. So an insufficiency it means that your levels aren't quite optimal yet, but they're not. You can't classify them as being deficient. It's sort of a little bit of a grey area. Okay, and I'll talk a little bit about that shortly as well. So optimal levels for vitamin D are between 100 and 200 nanomoles per litre, and that is 40 to 80 nanograms per mil. High levels are classified as being 250, more than 250 nanomoles per litre or 100 nanograms per mil. So if you find that you have a vitamin D deficiency, there's sort of 3 different ways that you could treat it. Initially, number 1 is through food, but to be honest, this is inadequate as a treatment. It can help maintain, and it can give you a little bit of vitamin D. So there's small amounts of vitamin D in fish, and eggs and wild mushrooms, but not much vitamin D in anything else. Sun exposure without sunscreen is the best way to get your vitamin D levels, but I understand with skin cancer and fair skin and the fear of getting sunburn, that isn't always that practical for many people. But thirdly, there's vitamin D supplementation that we'll talk about. So let me give you some recommendations about sun exposure. So to get adequate vitamin D each day, you want to expose half of your body's skin. This is what I said, half of your body's skin, not just your arms and legs, but your tummy too, for half of the amount of time that it takes you to burn. Now, the reason I like this recommendation rather than 12 minutes in the sun is that it really bases you really base the time spent on your particular skin color and also where you are in the world. So I'm very fair skinned, and I live in New Zealand, which is a very harsh sun. So 5 minutes for me is probably adequate to get enough vitamin D for me if I go out and show half of my body to the sun. However, I know that there are people that are very dark, and their skin color is dark, and they might, and so you may need to be in the sun for 2 hours to get adequate vitamin D levels. So when it comes to supplementation, my recommendation is to base your supplement dose on your blood tests. Now this is based on the Vitamin D Council's recommendations. So if you have a severe deficiency, the daily dose that you want to take is 5,000 international units per day. If you have a deficiency, 3,750 IUs per day, and insufficiencies take 2,500. And if you've got your levels are within the safe optimal levels, carry on with your current sun exposure or supplementation. If you have high levels, then you need to stop supplementing and contact your medical doctor. Any level over 375 nanomoles per litre is very toxic, and you need to take that seriously, because vitamin D is a fat soluble vitamin, so it can be toxic. Your body doesn't just pee it out. So take that seriously if you've got high levels in your blood. Now, I just want to just talk a little bit about this insufficiency area. So if your levels have come back that you're insufficient in vitamin D, keep the season that you are living in currently in mind. So if you've just had your testing done and you're at the end of winter, you may not need to supplement because you're going into summer, and assuming that you're going to spend a lot of time in the sun, your vitamin D levels will come up naturally. However, if your levels are insufficient, but it's only the start of winter, you've just been through summer and your levels should be high. If that's not the case, if you're going into winter, you'll definitely want to supplement some vitamin D. So just a couple more recommendations when it comes to vitamin D supplementation. So use vitamin D3 supplements and supplement vitamin K2 alongside the vitamin D. So vitamin K2 promotes the calcification of bones and prevents the calcification of blood vessels and kidneys. So the vitamin K balances out vitamin D's role on calcium, and the dosage that you want to aim for vitamin K2 is between 100 and 300 micrograms per day. So vitamin D and vitamin K2 are both well-tolerated medications, and there's no concern with taking them alongside antidepressant or anti-anxiety medication. However, talk to your doctor before taking vitamin D or K if you're on creams for psoriasis, a thiazide diuretic, any medications for atrial fibrillation, or medications for blood thinning. Also talk to them before taking these supplements if you have any of the following conditions: primary hyperparathyroidism, lymphoma, a granulomatous disease, kidney stones or kidney disease, or a liver disease. And that wraps up vitamin D, and we're going to move on and talk about zinc and copper. So we're now going to talk about zinc and copper, and this is one of the most favorite topics of mine. Zinc is so important for mental health, and so important for lowering anxiety and improving mood. And I just wanted to encourage you to keep moving through the course, keep implementing what I've recommended, keep trying to resolve these deficiencies, as they make such a huge impact on mood and energy levels. And I just wanted to share this one testimonial from a client of mine here in New Zealand. He said, "I don't have words in my dictionary to say thanks, but you changed my life entirely. Your advice and suggested supplements entirely brought me out from the painful and depressed life I was living. I felt so well from the first day I followed your advice. I am now full of a lot of energy, which I never had. I was on the edge of my life, but now I can see I have a very beautiful life ahead, and I have a lot to do for myself and my family. I have beautiful plans and dreams to fulfill. Without your help, these were not possible." And we're going to talk about zinc now, and zinc was one of the things that changed this gentleman's life. He said, "I felt so well from the first day that I followed your advice." You know, that doesn't usually happen, but if you're treating a zinc deficiency, often you will experience improvements within a week or so. Sometimes it takes 6 weeks, but I've seen very quick improvements for quite a lot of people with zinc. So what is zinc? Zinc is a key mineral, and it's used in over 200 functions in the body. It plays a role in the immune system, helps the skin, is required for taste and appetite, protects against toxins, and is important for fertility too. So here's a few symptoms of zinc deficiency: reduced sense of smell and taste, white dots in the fingernails, so that's a big one. That's quite a key symptom for zinc deficiency, and also stretch marks too. Acne, poor wound healing, eczema and psoriasis, low immunity, cold sores, delayed puberty and infertility. But anorexia, depression, anxiety, panic attacks and obsessive compulsive disorder are all often associated with zinc deficiency too. Because zinc is important for mental health. It's actually the second highest mineral found in the brain, following iron, and it also helps to make serotonin, the calming neurotransmitter, and it's even thought to act as a neurotransmitter itself. Zinc deficiency is found in depression, anxiety and fibromyalgia, and here's just a couple of studies to show that. Zinc deficiency is found in patients with current major depressive disorder, bipolar, anxiety and fibromyalgia. Patients with treatment-resistant depression have lower zinc levels. It sounds a lot like folate, doesn't it? Yes, so if you have lower zinc levels, you'll be more unlikely to respond to antidepressant medication. Zinc deficiency correlates with the number of tender points in fibromyalgia, and zinc treatment has been shown in small studies to resolve depression too. Also an observational study in which they showed that high intake of zinc decreases the risk of developing depression by 30 to 50%. So even improving your diet, following the recommendations that we did in module number 2, optimizing your diet and improving your zinc levels, can improve your mood. So I just wanted to teach you a little about pyroluria, and it's a condition that is related to zinc deficiency, and it's very important in mental health. So pyroluria runs in families with high levels of mental health conditions. So if you personally have a family that has a lot of mental health conditions running through it, think about pyroluria. So you may have problems with depression or anxiety or autism, bipolar disorder, schizophrenia, even just having the tendency of being a worrier, also oppositional defiance disorder, violence and addictions too. So pyroluria is also known as the Mohs factor or cryptopyrrole, so it goes by a number of different names. So what happens in pyroluria is that there are high levels of pyrrole molecules that are abnormally produced. And these pyrrole molecules bind to and lead to zinc and vitamin B6 deficiencies. And then the zinc and the vitamin B6 deficiencies go on and cause the mental health concerns and other physical symptoms that I'll talk about in a moment. But one of the hallmarks of pyroluria is that individuals with this condition have a reduced tolerance to stress and have a lot of high inattention. So if you've got mental health concerns that run in the family and you don't tolerate stress very well, then consider pyroluria. And then also look at the cluster of symptoms that occur in pyroluria, which we'll discuss next. So a lot of the symptoms of pyroluria are similar to zinc deficiency symptoms, and you can see them there under the physical symptoms and neurological symptoms. The ones that I always am looking for are white dots in the fingernails and stretch marks, and possibly delayed puberty. Neurologically, yeah, any mental health concerns that run in the family, as well as anorexia, because zinc is really important for appetite, and if you have a zinc deficiency, you just don't have appetite, and that can lead to anorexia. Some of the other symptoms of pyroluria include crowded front teeth. Also, Jekyll and Hyde mood swings. So people might say, you know, the two different people. One moment they're okay, and then the next moment they just lash out. Also, all female families may be a sign of pyroluria, because if you're pregnant with a male, they take a lot more zinc to produce the testes, and so those babies are often miscarried, and so you end up with the families of just all girl siblings. Also, joint pain may be a problem from reduced collagen production, and also another telltale sign is nausea or poor morning appetite. So let's have a look at some of the causes of low zinc. So as I said, pyroluria is a cause, and we think that it's genetic and that it runs in families, but we don't know what the gene is specifically, so there's not a gene that we can test and diagnose you that way. Other causes of low zinc include low dietary intake, and this is common in vegan and vegetarians because they eat a lot of whole grains and legumes, and due to the high phytate content of those foods, zinc is often not well absorbed. Another reason for low zinc levels is impaired absorption, so that may be due to low stomach acid or malabsorption or celiac disease, or even alcoholism and cirrhosis are another cause for low zinc too. The fourth cause of low zinc I've put here is copper overload, and I put a little asterisk because it's not really that you've got low zinc, but there is an imbalance between the zinc and the copper ratio, because zinc should be higher than copper, but when there is a copper overload, it can lead to similar symptoms to a zinc deficiency, and it can definitely make a zinc deficiency worse. So let's talk a little bit more about this copper overload. So copper and zinc are in balance in the body, and zinc should be slightly higher than copper. When zinc is low and or copper is high, this leads to anxiety, psychosis and depression, and it's also found in other mental health conditions such as autism. Some causes for copper overload include copper leaching from old copper pipes, also copper from intrauterine device, an IUD, so a contraceptive, but also the oral contraceptive pill containing estrogen can lead to copper overload. And zinc deficiency also allows copper accumulation. So I just want to talk a little bit about copper excess, and this can also be caused by pregnancy and the oral contraceptive pill. So depression and anxiety is one of the side effects of the oral contraceptive pill, and high levels of estrogen from the oral contraceptive or from pregnancy can lead to increased copper. So symptoms of high copper include anxiety, psychosis, insomnia, and postnatal depression. The problem is that the oral contraceptive kind of leads to a gradual increase of copper levels over time, and this may take years. So there's often no correlation between starting the oral contraceptive and the onset of the depression or anxiety. They can be years apart. Therefore, high copper levels are often overlooked and they're quite insidious, so we have to test for them. So when it comes to zinc testing, we've gone through this earlier, but a severe deficiency of zinc is if you have levels below the 11 micromoles per litre or less than 73 grams per decilitre. A deficiency is between 11 and 14 micromoles per litre, which is 73 to 92 grams per decilitre. An optimal level for zinc is 15 to 20 micromoles per litre, which is 97.5 to 130 grams per decilitre. And more than 20 micromoles per litre or 130 grams per decilitre is considered high level. So if your blood tests get to that stage and you're supplementing, then you want to stop supplementation then. With copper, a deficiency is less than 11 micromoles per litre or 70 micrograms per decilitre. An optimal level is between 11 and 15 micromoles per litre, in my opinion, which is 70 to 96 micrograms per decilitre. And levels higher than 17 micromoles per litre, which is 108 micrograms per decilitre, is considered to be elevated. So let's talk about zinc supplementation. Well, a therapeutic dosage of zinc is in the range of 40 to 75 milligrams of elemental zinc per day. Note that this is a high dose specific to mental health and should only be taken at this level if blood test levels are low. What I usually recommend is that you base your dose of zinc on your body weight. So the calculation that I use is 25 milligrams of zinc plus half a milligram per 1 kilogram of body weight. So that means if you're 60 kilograms, you would be taking 55 milligrams of zinc per day. And if you're 100 kilograms, then 75 milligrams of zinc is a therapeutic dosage for you. Keep in mind that you may need to take zinc supplements for the rest of your life if you have pyroluria, and stopping them for as little as 2 days can lead to symptom deterioration. So I've seen this a lot with my clients, that if they've got pyroluria, they respond very quickly to zinc. So the testimonial at the beginning of this section, they said overnight basically he felt better, and I've seen it in 5 days before as well. Other people do take a little bit longer, so don't be discouraged if you don't respond as quickly. But the problem also is if you stop your zinc, you can deteriorate quite quickly. So if you even just miss 2 days in a row, your mood may decrease and your anxiety may start to climb. So this is something that you want to be consistent taking. The good news is that zinc is a very well tolerated supplement, and it often helps reduce side effects of other medications too, which is awesome. The main potential side effect of zinc is nausea. So if you do feel a bit sick after taking zinc, ensure you take zinc straight after food, and alternatively take the zinc with larger, heavier meals such as at dinner time. If you have high copper, zinc supplementation may cause your body to release copper. So this may lead to some detox reactions initially. So if you are sensitive to supplements, start zinc at low doses and increase your zinc dose slowly over a week or two. So here's some recommendations regarding elevated copper. If you're on an oral an estrogen contraceptive pill, consider alternatives as that's an option for you. Also treat zinc deficiency as I've described above, as the zinc supplements will lower copper over time. If you have quite excessive copper levels, then molybdenum supplementation can also lower the copper, and 1 milligram of molybdenum glycinate per day is what I recommend. Now, if you think that you may have pyroluria, and that sounds like you, and it seems to run in your family, you can test for pyroluria. And there are different integrative testing labs around the world that do this test. However, the test is very time sensitive, so you have to be careful about where you are getting your testing done. I don't do it here in New Zealand just because it isn't accurate enough because of travel time with samples, but I just use the combination of zinc and copper testing as well as a strong family history to diagnose pyroluria. So if pyroluria is indicated, I suggest that you supplement with both zinc and vitamin B6. And the dosages for vitamin B6 are between 100 and 500 milligrams daily. So you start with the lowest dose and you work up. Now there's no common tests for vitamin B6. So what we do is we base your vitamin B6 dose on dream recall. If you don't remember your dreams, increase the B6 dose, and if your dreams are too vivid, you lower the dose. Okay. A possible side effect of high dose vitamin B6 is neuralgia, so nerve pain and tingling. So reduce your dose if you experience this. It's usually with the higher levels of B6 dosages, such as the 500 milligrams per day. So I just wanted to answer the question, can you increase zinc with food alone? Well, remember that the therapeutic dose for mental health is, between 40 and 75 milligrams per day. So let's just state here that, you want to aim for 50 milligrams. Well, to get that, you're going to have to be eating 8 oysters a day, 1 kilogram of beef, either or of these, or 76 eggs, or 6.5 cups of nuts, or 4 cups of seeds. So you can see trying to get therapeutics of dosages of zinc just really aren't practical. Maybe the oysters, but I doubt that you're going to have 8 oysters every day of your life. So it's much easier to take a high dose zinc supplement. just want to finish off with a testimonial. So firstly, my client who had fibromyalgia hasn't experienced any more symptoms since she started taking the zinc. It's amazing and so simple. Thank you on her behalf for introducing us to these things. So this is Joy, a counsellor in Auckland, and she learnt from me about zinc deficiency, and yeah, just showing that fibromyalgia can be healed with the zinc very quickly and very easily. And I know that this could change your life too. So that ends the section on zinc. But now I want you to go and order those supplements that you need. If you've found that you have a deficiency in zinc or any other minerals or vitamins, go for it, because it really could change your life. And next, I want you to make sure that you come and listen to the next section, in which I talk about supplements, potential side effects, and follow-up testing. So I hope you've really enjoyed this module and that you've uncovered some deficiencies that may be really impacting your mood or your anxiety. So make sure that you think about the ways that you can optimize your diet to improve the levels of those nutrients in your diet, and also ensure you're getting on to supplements to treat those imbalances. But now we're going to give you some guidelines about choosing your supplements, and also potential side effects, and also follow-up testing and staying safe on your supplements. So I just wanted to give you some keys to buying supplements. Make sure that you read the labels and follow my directions. So ensure you're taking elemental dosages and follow my dosage guidelines, not what's on the bottle, okay? I have some clients that do this and get this wrong too, so it is common. But I give you therapeutic dosages, okay? So on the bottle it may say to take 1 capsule, but I might recommend for you to take 3 capsules. Remember, we're basing this on your testing, and we're basing this on therapeutic dosages. So dosages may also vary from different brands and different countries. So for example, you can get zinc and it will only contain 50 milligrams a capsule, but then you can get other bottles and other brands that are 50 milligrams per cap. So make sure that you're reading the labels and checking them out. Also with omega-3, remember how I said you must look for a product that has high EPA versus DHA. So it's the EPA that's the most important component for mental health. So remember, dosages do matter. If you don't take enough, the supplement might not help you at all, and you might not get the benefits that you could if you took a higher dose. And remember to check out my bonus document that I've created for you, the Real Relief Supplement Guide. And in there I list supplements that are available through iHerb that you could take. Now I've given you 2 recommendations, one that are higher quality, but often what goes with that is a higher price tag. But then I've given you a more cost-effective product that you could consider as well. So just the base is just really based on your values and your financial situation. So just keep in mind that with all supplements, we all respond differently, and there are, you could have some reactions to these supplements. So if you're worried that you may be responding negatively to a supplement, follow these guidelines. So firstly, it's best to start new supplements one at a time, okay? And then you know if you're reacting well and what's giving you a beneficial effect. If you suspect that you're reacting to something, stop all of your supplements or the most recently introduced supplement. Then wait. So it's stop, wait, and reintroduce. So you stop what you're taking, you wait for the symptoms to resolve to see if the thing that you think is a side effect resolves when you stop taking it. And if it does, then one of your supplements may be giving you the symptom. You know, sometimes you'll have a sore tummy and you'll think it's a supplement, but it's actually a tummy bug. So, you know, you just have to take it one step at a time. So stop your supplements, wait for the symptoms to resolve, and if they do resolve, then it's probably one of your supplements. So then the next point is to reintroduce, and reintroduce the supplements one at a time, every 3 to 5 days. So if you're only introducing a new one every 3 to 5 days, it gives you enough time to make sure that you're not having a bad side effect with a supplement. Monitor whether the supplements reappear and which supplement caused it. Don't continue a supplement if it isn't right for you, okay? Look for an alternative. If you were treating a specific deficiency, here's a few ideas. Trial a different form. Example for magnesium, rather than taking a citrate magnesium, try a glycinate product. Maybe trial a different product, a different brand with slightly different ingredients, because you know some products will have some herbs in them or B vitamins. Yeah, as I said, try a different brand, try a different product, or just trial lowering the dose. Maybe you'll tolerate a smaller dose. So I'm hoping that you followed my advice right in module 1, where I said to streamline your supplements right at the beginning. So if you're feeling a little bit overwhelmed with all your supplements, here's a few questions that you can ask yourself that can help you streamline them. So do you have blood test results that are low and show you that you are deficient in a mineral or vitamin? Then make sure that you're supplementing with that. And also, if your stomach acid levels, if your stomach acid tests show that you had poor stomach acid levels, then you want to consider betaine hydrochloride. If you have a blood sugar imbalance, obviously optimize what you're eating, adding more protein and fat into each meal, but you could supplement chromium or alpha lipoic acid. Also ask yourself if you've got particular symptoms. Do you have digestive complaints? Maybe supplement with a probiotic, collagen, or an intestinal healing supplement. If you've got anxiety, muscle twitches or cramps, headaches or insomnia, supplement with magnesium or do some Epsom salt baths. If you have chicken skin on the backs of your arms, or you're eating no fish, or you have long-term depression, then consider high doses of the EPA form of omega-3. Another question I'd ask yourself is, can you feel the difference with this particular supplement? Okay, if it doesn't if you don't answer yes to the previous 3 questions, then maybe, and you don't feel a difference with that supplement, maybe let that go. And then finally ask yourself whether you have a genetic weakness and you actually need some supplements to help compensate for that genetic weakness. So next I want to answer the question, how long do I stay on supplements? Well, to be honest, there's no easy answer. I recommend that you start with higher dosages for 3 months to build up your body's levels, and then trial lowering down to a more maintenance dose. Also retest your blood levels to monitor your need, and also I suggest that you see module 6 for further discussion on optimizing your supplement regime, because I'm going to give you some further recommendations there. But let's talk about retesting. So with your blood test, I would be recommending that you retest after 3 months to see that your levels have come up, and making sure that they're not too high. Then after that, I would recommend that you test another 6 months later, and then if your levels seem to be right and maintaining, then I would do it yearly after that. Remember to stop supplements 3 days before your blood test so you get a true level of what's actually in your blood and in your body. So with repeat testing is especially vital if you're taking high dose vitamin D supplements, so more than 2,000 international units per day, because vitamin D is a fat soluble vitamin and it can build up in the body if it's taken in high dosages for too long. So with vitamin D, retesting is a necessity. Okay, if you are taking zinc more than 25 milligrams a day, I would be repeating the zinc and copper testing regularly, as zinc supplements can lower copper levels. So that's something that you have to look out for, and you want to make sure that your copper levels don't get too low. If you're taking iron long term, I would also be doing repeat testing, as high iron levels are bad for the brain. So here's just some ideas about how to interpret your repeat blood tests. So if your low levels have not improved, then either increase the supplement dosage up to the maximum recommended dose, or continue at the current high dose that you're on and just continue it for longer. But remember to address any of the causes for that deficiency. So for vitamin and mineral deficiencies, review your diet and your lifestyle. If your levels have improved in these blood tests, maybe reduce your supplement dose by 50% and retest your levels in 6 months' time to ensure that this dose is adequate, to make sure that your levels stabilize in your blood. If your levels are high after that first repeat test, reduce your supplement dose by 50% and retest your levels in 6 months' time to ensure your levels are optimal. So now we're just going to finish with a few aims for the week. So initially, just review your blood tests. I think you probably would have already done that, but find out which nutrients you are deficient in, and increase foods that are rich in the nutrients you're deficient in, okay? And go to the bonus Real Relief Real Food Planner, and that will give you some lists of foods that you can incorporate in your diet specific for any nutrients that you find that you're low in. Order supplements if blood testing shows you're deficient. Review supplement symptoms for magnesium and omega-3 deficiency, and supplement if appropriate. Consider having regular Epsom salt baths to increase your magnesium, and increase your fish intake to improve your omega-3 levels. Be intentional about exposing your skin to the sun for those with low vitamin D, and always remember to do blood testing in another 3 months' time. So I hope you've enjoyed that module, and I'll see you in module number 6.